There always is a baseline, and what I mean by that is we want to be doing everything we can to decrease inflammation in the body. So a huge proponent of that is obviously working on the diet and lifestyle standpoint. Anything that we can do, again, to lower inflammation when we choose to eat healthy foods is going to help you respond better to what we're doing with the modalities we have. And it could be a huge reason why you're having a lot of these issues to begin with. So for example, I have a lot of fibromyalgia type patients. Once we really start to engage them and help them understand that their diet is probably playing a role in a lot of their symptoms, a lot of people who are in pain are usually pretty good patients because they're willing to do what you ask them to do, which is great. So what they see is once we start to modify the diet, I see a lot of patients who have, even a 50% or so reduction in pain patterns once they start to take out the inflammatory foods. My big three is what I would start with most patients is getting dairy out of the diet, getting gluten, your breads and your pastas and all of that stuff, and then sugar. I mean, those three things alone to start with is so helpful for so many people.
Yeah, that really actually helped me. But it's hard, right? Because people,
it's very hard.
Diet is a hard one to change and modify. But to your point, if you're in pain,
right,
it's easier.
Right. And what I think we're starting to see as well is that the Western world is realizing how much of your immune system actually lives in the gastrointestinal tract. So whenever there is any inflammation in the GI, we start talking about autoimmune disease and fibromyalgia and chronic fatigue and those types of things. Once you heal the gut, that's going again to make it so much easier to do the rest of the healing with other treatment modalities that we'll talk about, and just make the experience much easier in moving forward.
So I've heard the gut referred to as the second brain, and if there is less inflammation in your gut, then it makes sense that systemically you would have less inflammation. Is that correct?
Absolutely. And how I describe that to patients is when people have a lot of stress in their life and they get stomach ulcers, how does that even make sense, right? Because it's like, why don't you get a brain ulcer if you're stressed out? You get a stomach ulcer. Interesting. Or when you hear that really bad news and you have that stomach drop sensation, that's weird. Why don't you get a headache? Or why doesn't something happen in the brain? So there is a lot of nervous system tissue or brain-like tissue in the gastrointestinal tract. We're starting to see, again, as we treat the GI and get people on those healthier lifestyles, a huge variety of symptoms seem to improve as well.
That is fascinating.
It is really cool.